This video is intended for patients who have been prescribed the LifeVest, as well as their families and caregivers. It will provide an overview of the LifeVest wearable cardioverter defibrillator and includes information about assembling, wearing, and caring for the LifeVest. Chapter 1. LifeVest Protection from Sudden Cardiac Death. Every year, thousands of people like you are told by their doctor that they are at risk of dying suddenly because of their heart condition. This means that the heart could develop a life-threatening heart rhythm, which, if not treated quickly, could lead to death in minutes. This is called sudden cardiac death. This news can be difficult to accept and usually comes at a time when you may already be overwhelmed with talk about lifestyle and dietary changes, important medications, and possible medical procedures. You may be asking, what exactly is sudden cardiac death? What is the LifeVest and why do I need one? How long will I need the LifeVest? And how can I get my questions answered? In this video, we will discuss these and other questions you may have about the LifeVest wearable defibrillator, including how the LifeVest can protect you from sudden cardiac death. Let's begin by answering the first question. What is sudden cardiac death? This is what a healthy heart looks like as it pumps blood through the body. This rhythmic pumping action is the heartbeat, and this is controlled by the heart's electrical system. In some patients, there is a problem with the heart's electrical system, and the heart suddenly starts beating so fast that it quivers or shakes instead of pumping blood to the body and brain. When this happens, the patient can collapse and die suddenly. This is called sudden cardiac death, also known as SCD. It occurs without warning. Some people confuse sudden cardiac death with a heart attack, but they are not the same. A heart attack is caused by a blockage that stops blood flow and the oxygen supply to part of the heart. Within a short time, these cells start to die, causing damage to the heart. With a heart attack, a person may feel severe chest pain or other symptoms, but usually remains conscious. Sudden cardiac death, however, occurs without warning and without the person feeling any signs that something is about to happen. With sudden cardiac death, you suddenly fall unconscious and will not be able to call for help. It may even happen while you sleep. The LifeVest can protect you from sudden cardiac death by delivering a treatment to restore your heart's normal rhythm. With the LifeVest, the monitoring is constant, the protection is immediate, and you and your loved ones will have the peace of mind that comes from knowing that the LifeVest is ready to help you if you need it. Now, why do you need the LifeVest? Your physician has prescribed the LifeVest to you because your current condition puts you at risk of dying suddenly. The LifeVest is a wearable defibrillator that is worn by patients who are at risk for sudden cardiac death. A defibrillator is a medical device that provides a treatment shock to the heart when a life-threatening heart rhythm occurs. Wearing the LifeVest makes sure that you are always protected because the LifeVest constantly monitors your heart. If the device detects that you are having a life-threatening heart rhythm, it will automatically deliver a treatment shock and restore your heart back to its normal rhythm, usually in less than a minute. The LifeVest does not need anyone else to be there with you or to intervene in any way for it to work to save your life. The LifeVest's ability to quickly treat a patient is the single most important factor in saving that patient's life. Your life. All you need to do is wear the LifeVest and provide minimal care. Because sudden cardiac death can happen at any time and without warning, you must wear the LifeVest at all times, even while you sleep. This means wearing your LifeVest when you go to your place of worship, to the restaurant, to do chores around the house, even to your next doctor's appointment. How long will you need the LifeVest? Your physician will determine how long you will need to wear the LifeVest. So until your physician tells you that you no longer need to, wear the LifeVest all day, every day, even if you feel like your heart is doing better. The only time you should remove your LifeVest is for a short shower or bath. Remember, sudden cardiac death occurs without warning, but your LifeVest will protect you if you wear it all the time and wear it as instructed. Preferably, you should try to take your bath when someone is at home with you. One of the key features of the LifeVest is the alerts and voice prompts that keep you informed about what the device is doing. The LifeVest has 3 types of alerts: vibration alerts, gong alerts, and siren alerts, which inform you of different situations. The alerts are all part of the normal functioning of the device and let you know that the LifeVest is working to protect you. If you get an alert, you should take action quickly by checking the LifeVest monitor to see what action is required. For vibration and siren alerts, you should quickly press the response buttons. For more information on LifeVest alerts and directions on how to respond when you feel or hear the alerts, review the chapter entitled Responding to LifeVest Alerts, or check your patient manual. Your patient manual also contains additional information about the LifeVest, including details about regular washing and other care. If you have any questions, please review these materials carefully. Here are some important reminders. There are no symptoms for SCD. It can happen at any time. Wear the LifeVest at all times so that you are always protected. Only remove your LifeVest for a short shower or bath. If you still have questions about the LifeVest, call ZOLL at 1-800-543-3267 at any time of the day or night. We are here to answer questions and provide assistance with your needs. Call us at 1-800-543-3267 anytime. Chapter 2. About the LifeVest. The LifeVest is lightweight and easy to wear. It consists of 2 main parts: a garment and a monitor. The monitor can be worn on the belt or from your shoulder. At the top of the LifeVest monitor, you will find the connector. This connects the monitor to the electrode belt. The battery is inserted into the monitor to power the LifeVest and also acts as the on-off switch. The LifeVest is automatically powered on when a charged battery is inserted into the device. When removing the LifeVest to shower or to change the garment, you must first remove the battery from the monitor. After removing the battery, unfasten and remove the garment. For more information on removing the battery from the LifeVest monitor, please refer to your patient manual. You received 2 batteries with your LifeVest system. While you're using one battery, the other should be charging. Make sure you change the battery in your LifeVest every 24 hours. The 2 identical buttons located on the front and back of the monitor are the response buttons. If you receive a siren alert, the LifeVest is signaling that you may be having a life-threatening heart rhythm. The siren alert lets you and bystanders know that the device is preparing to provide a treatment shock. If you are able, you should press and hold the response buttons to delay treatment. When you press and hold the response buttons, the siren will stop, and you will hear a voice that will let you know that the treatment has been delayed.
Treatment has been delayed.
Remember, only you should use the response buttons. No one else should ever press and hold the response buttons for you. If you do not press the response buttons, the LifeVest will decide you are unconscious and will deliver the treatment shock. We have reviewed the main parts of the LifeVest monitor. Now we will review the garment. The LifeVest garment is worn under the clothing, directly against the skin, to hold the electrodes and therapy pads against the body. All underwear and clothing must be worn over the LifeVest garment, not under it. It is important to change and wash your garment every 1 or 2 days. A belt, which contains the electrodes, a vibration box and therapy pads, is attached to the garment. This belt is called the electrode belt. The electrodes monitor your heart's electrical signal. The vibration box notifies you that the device is preparing to deliver a treatment shock. If you get the vibration alert, you should quickly press the response buttons. The therapy pads deliver a treatment shock to the heart. Your patient manual contains additional information about the LifeVest, including details about the various parts and how to care for them. If you have any questions, please review these materials carefully. Remember, change the battery in your LifeVest every 24 hours. If you hear a siren alert, press and hold the response buttons. No one else should ever press or hold the response buttons for you. Wash the garment every 1 or 2 days. If you still have questions about the LifeVest, please call ZOLL at 1-800-543-3267 at any time of the day or night. We are here to answer your questions and provide assistance with your needs. Call us at 1-800-543-3267 anytime. Chapter 3. Wearing the LifeVest. The LifeVest is designed to continually monitor your heart so that it can deliver a treatment shock when you need it. The LifeVest is also able to provide your physician with information on the way your heart is working and responding to medical therapy. In order to make sure that you are always protected, it is important that you assemble and wear your LifeVest as instructed. We will now review how to put together the electrode belt and the garment. Before you begin, lay both the electrode belt and the garment on a flat surface. Lay the garment down with the silver fabric facing upward. Lay the electrode belt next to the garment so that the silver sides of the therapy pads are facing upward as well. Now you can get started. The first step is to insert the pair of therapy pads into the large pockets of the garment. These pockets are called the rear pockets and are numbered 1. Make sure that the silver sides of the pads, the sides with the green stickers, are facing the silver mesh on the pockets. Secure the pads in place by closing the snaps. The second step is to attach the vibration box. To do this, position the vibration box in the area with the number 2. You may need to check your patient manual to see how to attach the vibration box for your LifeVest. Secure the vibration box in place. To do this, pull the flap over the vibration box and use the blue tabs to snap into place. Ensure that all 3 snaps are securely fastened before proceeding. When you have secured the vibration box in place, insert the single therapy pad into the front pocket. The front pocket is numbered 3. Once again, make sure that the silver side of the pad with the green sticker is facing the silver fabric on the pocket. When the therapy pad is fully inserted, snap the pocket closed. The final step in putting together the electrode belt and the garment is to attach the electrodes. To do this, match the colors on the back of each electrode to the colors of the Velcro on the garment. This is what your assembled electrode belt and garment should look like. Now that you have attached the electrode belt to the garment, you are ready to put on the garment. In order to work correctly, the LifeVest therapy pads and electrodes must be against the body. The silver mesh of the garment must be pressing against your bare skin. So, before you put the LifeVest on, remove all clothing from your upper body. Then, slide the LifeVest garment on like a backpack and hook it together at the front of your chest. Make sure that the hooks are fully inserted past the bumps in the clips. When done correctly, you should hear an audible click sound. Women should put on the LifeVest before putting on a bra. Every time you put on your LifeVest, make sure that the garment is not twisted and that the silver side of the therapy pads is facing the silver mesh and is against your skin. After you have put on the garment, connect the electrode belt to the monitor. This must be done carefully, so check your patient manual to see exactly how to connect the electrode belt to the monitor. After the electrode belt is connected to the monitor, insert a fully charged battery into the monitor. When you insert a charged battery in the LifeVest, the startup process will begin. You will hear a repeated gonging sound and feel a vibration. When this happens, press and release both of the response buttons at the same time to activate the LifeVest. If you do not hear a gong alert or feel a vibration within 30 seconds, remove and reinsert the battery. Remember to press and release the response buttons when you hear the gong to activate the LifeVest. Once activated, your LifeVest is ready to monitor your heart and protect you. Your LifeVest comes with 2 batteries. While you're using one, the other should be charging. Place the used battery into the charger and firmly push it into place. Read the battery status on the charger to ensure that the battery is being charged. Leave the battery in the charger with the charger plugged in at all times until you again need to change the LifeVest batteries. It is best to make battery changing and charging part of a daily routine. We recommend that you change the battery around the same time each day, preferably as part of your morning routine to make it easy to remember. For more information on inserting and removing your batteries, please refer to your patient manual. It is very important that you wear the LifeVest as instructed and download data from your LifeVest device regularly, at least once a week. If your device has not sent data in more than 7 days, you will receive a prompt when you insert the battery instructing you to send data manually with a message on the monitor saying, "Time to send data." For more information on how to send data to ZOLL, please refer to your patient manual. Remember, it is important to assemble and wear your LifeVest as instructed so that it is ready to protect you if you need it. Before putting on the LifeVest, remove all clothing from your upper body. The silver mesh of the garment must press against your bare skin. Make charging and changing the battery part of your daily routine. Send data from your LifeVest at least once a week. If you still have questions about the batteries, garment, or downloading and sending data, call ZOLL at 1-800-543-3267. Chapter 4, Caring for the LifeVest. We have shown you how to assemble and wear the LifeVest. Now we will review some important tips on caring for the LifeVest device. When you are fit with the LifeVest, you receive one garment. You will receive a second garment in the mail. After you receive the second garment, you should begin changing and washing the cloth garments regularly. We suggest you wash the garment every day or every 2 days. Do not wash the electrode belt, monitor, or any other accessories, as this will damage the electrical components of the LifeVest. To prepare the garment for washing, remove the electrode belt so that it will not be damaged. To take the electrode belt out of the garment, first unfasten the electrodes from the Velcro on the garment. Take care to pull on the electrodes and not on the wires. Next, carefully remove the vibration box from its place on the garment. Do not use the vibration box to lift or pull the electrode belt, as this could cause damage to the internal wiring. Now, unsnap and carefully remove the 3 therapy pads from their pockets. Take care to pull on the therapy pads and not on the wires. Finally, when the electrode belt is completely removed, fasten the ends of the garment together. Your garment is now ready to be washed. Reassemble the electrode belt into the second garment, put on the LifeVest, and insert a charged battery into the monitor. Here now are some important washing tips. Wash the garment in warm water by itself, not with any other laundry, and use only mild laundry detergent, a sample of which is provided with your second garment. Do not use chlorine bleach or bleach alternatives. Do not use fabric softeners or anti-static sprays. Do not use detergents that include bleach or fabric softener additives. The garment should be dried in the dryer by warm or medium heat. Never use high heat. Do not get your LifeVest wet. Never bathe or shower while wearing the LifeVest. When you remove your LifeVest to take a bath or shower, always remove the battery from the monitor before taking off the garment and the monitor. It is important to care for your LifeVest so that it is ready to protect you if you need it. Wash and change the cloth garment every 1 or 2 days. Do not use chlorine bleach or bleach alternatives, fabric softeners, anti-static sprays, or any detergent that contain these additives. Do not wash the electrode belt or monitor. Never bathe or shower in the LifeVest. Always remove the battery before taking off the LifeVest. If you have additional questions, refer to your patient manual for more information or call ZOLL at 1-800-543-3267. Chapter 5. Responding to LifeVest Alerts. Wearing your LifeVest will ensure that you are always protected from sudden cardiac death. While wearing the LifeVest, you may get an alert. It is very important for you to know what the alert means and how to respond. Remember, these alerts are part of the normal functioning of the LifeVest and let you know that it's working to protect you. If you get an alert, you should take action quickly. The LifeVest has 3 types of alerts: gongs, vibrations, and sirens. The gong alert is a low-pitched gong sound that repeats about once every second. This type of alert is not part of the treatment sequence, but it is accompanied by a message on the monitor letting you know that the device needs your attention. Read the message on the monitor screen to determine what action you need to take. There are several events that can cause the LifeVest to produce the gong alert. Therefore, it is important to look at the monitor screen to see what action you need to take. Please refer to your patient manual for more information on gong alerts and messages. Another type of alert you may get is the vibration alert. The vibration alert comes from the vibration box on the electrode belt on the back of the garment. You will feel the vibration alert on your back each time you change the battery. If you feel the vibration alert at any other time, you are being alerted that the LifeVest has detected a life-threatening heart rhythm and has started the treatment sequence. When you feel the vibration alert, you should press and hold the response buttons to delay the treatment sequence. Pressing the response buttons tells the LifeVest that you are awake and do not need a treatment shock.
Treatment has been delayed.
If you release the response buttons and the LifeVest still detects a rapid life-threatening rhythm, it will begin to vibrate again. If you do not press and hold both response buttons, a siren alert will sound a few seconds later. The siren alert lets you and bystanders know that the LifeVest may have detected a life-threatening rhythm. The 2-tone siren starts low, but increases in volume as the treatment sequence continues. Like the vibration alert, you can stop the siren alert by pressing and holding the response buttons. If you don't press the response buttons, you will receive a treatment shock in as little as 25 seconds. When you press and hold the response buttons, all alerts will stop, and you will hear a voice prompt that will let you know that the treatment has been delayed.
Treatment has been delayed.
You may continue to hold the response buttons. When you release the response buttons, the LifeVest will continue to monitor your heart. If it continues to detect a life-threatening rhythm, the alerts will resume, and you should again press and hold the response buttons. Only you, the patient, should use the response buttons. No one else should ever press and hold or use the response buttons for you. If at any time you feel dizzy, find a place to sit or lie down. If you lose consciousness, you will no longer be able to hold the response buttons, and the LifeVest will deliver a treatment shock to restore your normal heart rhythm. This is the sequence of alerts and voice messages that the LifeVest would broadcast in preparation for delivering a treatment shock to a patient. The treatment sequence will begin with 5 seconds of vibration alerts. The vibration alerts will be followed by a low 2-tone siren alert that will broadcast for 5 seconds. The low sirens will give way to the loud 2-tone siren alert, which will also broadcast for 5 seconds. The LifeVest will then begin broadcasting voice prompts accompanied by the loud 2-tone sirens. You may hear,
Press response buttons to delay treatment.
If the response buttons are not pressed by the patient, shortly after the voice prompts begin, blue gel will be released and a treatment shock will be delivered. During treatment, the LifeVest prompts bystanders not to touch you. Bystanders may hear,
Bystanders, do not interfere.
If you receive a treatment, you may notice blue gel around the therapy pads on your chest and back. Blue gel is released by the LifeVest during a treatment to ensure the therapy pads have good contact with your skin for the treatment shock. After receiving a treatment, you should call your doctor immediately to report the treatment.
Treatment has been given. Call your doctor.
Do not take off your LifeVest. The gel may feel cold and wet against your skin, but the LifeVest will continue to monitor your heart as long as you keep it on. You should therefore continue to wear the LifeVest until you are told otherwise by your doctor or another medical professional providing care. Check the LifeVest monitor for messages and follow them. After contacting your physician, you should call ZOLL at 1-800-543-3267 as soon as you are able to report the treatment. Remember, alerts are part of the normal functioning of the LifeVest and let you know that it is working to protect you. If you get an alert, check the monitor and take action quickly. Use the response buttons to delay a treatment. Only you, the patient, should press the response buttons. For more information on LifeVest alerts and directions on how to respond when you feel or hear the alerts, refer to your patient manual or call ZOLL at 1-800-543-3267. Chapter 6, LifeVest Patient Support. ZOLL is here to ensure that you have a positive experience with the LifeVest so that you can focus on your recovery. ZOLL provides a full range of support for you and your family from the time the LifeVest is prescribed, through the LifeVest fitting, and until you no longer need protection from the LifeVest. Remember, your physician has determined how long you will need to wear the LifeVest, so until your physician tells you that you no longer need to, wear the LifeVest all day, every day. For your convenience, we offer 24-hour support. We are here to answer your questions and provide assistance with your needs. The support team can be reached at 1-800-543-3267 at any time, day or night. We can assist you with additional information on the LifeVest, technical questions about your LifeVest, insurance questions, paperwork, or other financial support, returning the LifeVest to ZOLL when your doctor decides you no longer need it, or any other questions you may have. Call us at 1-800-543-3267 anytime.